Good evening and welcome to a panel discussion on COVID-19, the Bahrain scene. Well, indeed it's an important time that we discuss the scene in Bahrain in terms of the pandemic, simply because we have been witnessing an unprecedented increase in the number of cases. Well, as we all know, Tuesday, April 3rd, Bahrain hit the highest ever number of cases of 1,316 ever since it registered its first COVID case in February last year. This number becomes important because we've been seeing numbers ranging from 700 onwards up to this 1,000 plus after we went as low as hundreds in the summer. And of course, we have had some tough times with fatalities, the month of February in 28 days recording 74 fatalities. Well, what do these numbers mean to us? Do they really show a pattern about the pandemic? Do we need to be really worried about it? Is it enough what we are doing? Of course, we know Bahrain is one of the GCC countries, the best among the GCC countries perhaps in terms of all the measures that it has in place from the government point of view. But is that enough? Despite all this, why are these numbers here? And that's why this talk this evening from BMC Global Live. So joining me this evening is an eminent panel of 3 experts. Let me introduce them to you. With me first, I have Dr. Hind Al-Sindhi, a Bahraini family physician. She's currently at the Hamad Kanu Center, and she's also a part-time lecturer with the RCSI, the Royal College of Surgeons in Bahrain. Well, she's a very active member of all community partnerships under the Health Directorate in the Ministry of Health. Welcome, Dr. Hind.
Most welcome. Thank you.
Next on the panel is Dr. George Cherian, the Corporate Chief Executive and Chief of Medical Staff at the American Mission Hospital, one of the largest private healthcare centers in the country. And Dr. George comes with a rich experience of over 30 years in the field, and he's someone who is always abreast on things, and that's why he's right with us this evening to tell us more about the scenario. And third on the panel, definitely not the least, is Dr. P.V. Cherian, who needs no introduction to anyone in Bahrain, the chief resident from the Salmania Medical Complex. Dr. Cherian, of course, I cannot limit him to the Salmania Medical Complex because he's out there and amongst us all, not only the Indians but beyond. Welcome all 3 of you to this panel, and as I said in the introduction, the panel is this discussion comes with such importance simply because of the numbers. So all those who are watching us and for the panelists, let's take it in 3 segments. The very first segment, let's analyze the scenario, the current scenario of these numbers, or what do these numbers mean to us. And the second segment, let's look at Bahrain with the rest of the GCC. What are the measures that we have in place, despite which, where are we going wrong, if at all we are going wrong? And finally, on the third segment, the most important thing of the time, the vaccines, the myths, the rumors, etc., etc. So let me begin with Dr. Hind on the very first question for the evening. On your opening remarks, as I rightly said, some figures, 1,316 is indeed a big number, yes, isn't it, for a country like ours? What do you think these numbers are telling us, Doctor?
Well, it's very unfortunate to have such a rise after a very low numbers previously, a couple months back. As numbers, the breakdown of numbers showed that most of the cases are because of contact. So it gives us a more idea that people are lacking the adoption for the precautions that we keep on reminding people among. And we've noticed lately there's a lot of violations in terms of wearing the mask that they announced even within the media, and within a lot of violations against that. And now it's even permitted, and they are by law. So they have to make sure that they wear the mask properly. So there's a lot of lenience in terms of the people, especially after they got vaccinated. I think that describes the high numbers. A lot of people thought because they are vaccinated, they are preventing, or they are not capable of getting the disease or getting infection, which is not the scenario at all. the vaccine is a way to protect you, to protect yourself, to protect the community and the society around you, but it's not a definite thing that you will not get the infection. So we still need to commit to the precautions that we are supposed to. We still need to wear the mask, maintain social distancing, avoid gathering, avoid contacting other families, to limit our contact to the small family, washing hands on regular basis, sanitizing on regular, going out and avoiding crowd only if necessary.
Mm-hmm. Yes, indeed, Doctor, that was a good start. As you said, the numbers were very low in summer.
Yes.
It was very promising at time,
yes.
And it's unfortunate to see that. Let me move on to Dr. George. Doctor, on the numbers, beyond this 1,000 crossing mark, we also had a history of crossing 10,000 mark in active cases. Yesterday, we touched 1,045, 10,045 active cases, and we have around 151 under treatment, with 63 of them critical. Of course, we do have high recovery rates.
Sure.
The mortality stand at somewhere around 514, 518, isn't it? What do these numbers tell us? Can we do an analysis on this, Doctor?
The numbers tell us two things. One, you have to look at the numbers, our numbers, in relation to what's happening in global numbers.
Yes.
If you look at the global numbers, if you look at Europe, if you look at North America, there is certainly an uptake of numbers because of what either it's a third wave or some people say it's a fourth wave. Now, why are these numbers exponentially going up? It is because, unlike what we faced last year, especially in summer, we have got new mutant strains. The B117, that's the UK strain, the B1135, which is the South African strain, and of course there is the Brazilian strains, and there are other mutant strains appearing on the scene. Now, Bahrain is experiencing this upscale in numbers because we now know the genome of what is spreading here is the UK strain of virus. That is 70% more infectious, and a lot of people don't understand what this infectivity, infectious means. And I'll give you an example. If you take measles as an example, measles has got an R rate of 15, meaning that one infected person can infect up to 15 people. So it is highly infectious. For COVID, SARS-2, which is the COVID-19 that we called it, that has got an R rate of about 3. One person can easily infect 3 people. So compared to measles, it is less infectious. Now, as long as the R rates remain above 1, one individual keeps on infecting other people around it, and most people think, what is the difference between 1 and 1.2? What people don't realize is, as soon as these R numbers shift from 1 to 1.2, there's an exponential increase in the total number of cases out in the community. And if the total number of cases out in the community increases, then you have more patients admitted into the hospital. And if you've got more patients admitted into the hospital, there is a select number of patients that will end up in intensive care. So the numbers, you have to sort of divide the numbers into the number of people actually who are SARS or COVID positive versus the number admitted into hospital versus the number admitted into intensive care. Right now, globally, all these three numbers seem to be going up, and that's worrying. If you look at Bahrain, for example, you alluded to 1,300. The number of admissions going into hospital is also going up, and the number of current people in intensive care is also high. At one point, it was down to 8, 9 people in the intensive care. So we thought we'd won this battle. Far from it. So I think we need, as Dr. Hind actually alluded to, all of the measures, including having your vaccination done and your social distancing, hand washing and masks, are absolutely important to contain this virus.
Great. Thank you, Doctor. Moving to Dr. Cherian. Of all these various axes, there are certain numbers which we need to bring down. There are certain numbers we are happy is going up, like the recovery rates, right? In your opinion, which is the crucial number that we have to really focus on?
Actually, as spoken by Dr. Hind and Dr. Jocherian, we have noticed that there is a very high spike in the recent days, especially from March 25th. It was a number has gone crossed over 1,000 per day. And the second thing, about the variants, even yesterday also we read about another variant in Japan, which is, they are saying that it is very, very deadly virus like that. It may infect more people, and even the deaths may be more. So we are mainly concerned, as we are aware and we are lucky about the R values of Mr. Dr. George Cherian pointed out. Although the infectivity was less, that was the only fortunate part of this viral infection. Otherwise, the number of cases are increasing and there are more people who are being admitted to the ward like that. We have crossed, we are almost reaching about 150,000 cases are here in Bahrain, and we have a death of around 540 which are happened already like that. And we are already we have come to a situation, to be frank, we have come to a situation whether we have to live with the COVID. We cannot go on avoiding the COVID, keep all the protocols and this thing. Although it is a must actually, we should follow this one. So our main concern at present is that it is the vaccination phase. If you look at the headline page of the Gulf Daily News 2 days back, it was written, "Take your jab." That was the main heading, it is there. Even from the Undersecretary for Ministry of Health, Dr. Walid Al-Bania and other people, they are all advising the public, this is the only alternative in front of us like that. So let us take the jab, let us reduce the number of people, and even if we get infected, we know that it is not 100% protective. We may be getting at least 70 to 90% or 95%, and if we are unfortunate in that 5%, still we may not go into a complication or a death like that. That's the main part of these vaccinations. So let us concentrate. Our main concern is that to reduce the infectivity by taking all the protocols which we have taken from the start. That is, we have been taking about the masking, we have been taking about the physical distancing, we have been taking about avoiding the overcrowding, hand washing. So these things should continue in spite you are vaccinated also. So our main concern is to prevent more complications, to prevent more deaths, and continue the vaccination drive.
All right. Thank you, doctors. Well, it's quite unfortunate that we are discussing certain bleak things, but definitely all the three experts, they guided us to one point, that we are yet to come to a phase where we can relax ourselves, isn't it? We need to be wary of the situation, especially with these variants, and something which we're really not sure of. Every day, new things happening. So with that, let's conclude this first segment, and on that note, let's take a short break. Welcome back to the panel discussion on COVID-19, the Bahrain scene from BMC Global Life. And joining me this evening is Dr. Hind Al-Sindhi, Dr. George Cherian, and Dr. P.V. Cherian. So in this next segment, Let's take ourselves and the viewers through the Bahrain scenario. Dr. Hind, let me start again with you. Bahrain has been in the forefront of fighting this pandemic. If you look back, even before we had the first case in February, we had, according to the government, we had measures in place. Could you please take us through the measures that Bahrain put in place?
Even as you mentioned, before the first case that's been discovered, Bahrain have prepared for the scenario and was ready from all aspects. The Bahraini government and the Ministry of Health have invested in the awareness of the people. And that was why we were able not to go into lockdown in comparison to other countries internationally. The airports continue to have their flights going on, and we were one of the leading countries in terms of recovery, and even until now with the rising of cases. Mainly the scenario that Bahrain went through was to focus on the Bahraini population awareness. They invested in the people where they had, they gave the people all the things that they need in order to prevent those cases. There was continuous awareness in all social media in terms of giving the health education possibly for the people. There are a lot of measures that have been taken in order to continuity of healthcare services. There is a lot of teleconsultations that were done. The change or modification that happened through the whole system in terms of education being virtually continuing, not affecting the flow of services in all the ministries or all services in Bahrain. So there's a lot of modification that happened during the past months that we can see in order to prevent the spread of the infection, yet maintaining the continuity and the high quality of services. So what we can see from the situation now, and especially lately, if we went to the clinical trials that happened, Bahrain was one of the leading countries in order to adopt the clinical trials and announcing the result, and even launching and rolling out the vaccine.
We touched almost 3 million PCR tests, isn't it?
Exactly.
Test, trace, and track, or track,
and
taste,
we have even the random testing, which was not done anywhere, and it's done for free.
Yes.
Even the tests that rapid test that was available with a very low fee in all pharmacies, that helped a lot in the detection, and even having it available for even within the health centers, that helped a lot in terms of the waiting time, that in order to get the appointment, to get tested, or the drive-through, and now recently opening of the new facility of the Citra Mall, Citra Mall for vaccine, but also there's another one next to the Qadra
Sheikh Rashid Equestrian Center.
So that's also coming ahead with the BIC and with the exhibition center for testing. So having those 3 places and working for 24 hours, along with the airport where there's also continuous of testing there, so, plus the random testing. So we are going into preventing or first-line screening. So whoever have any symptoms, any contacts, the tracing and tracking, the ones you mentioned, for the cases or contact of positive cases, have prevented and limited a lot in terms of spreading the disease and early detection.
Right. I'm sure you must be a proud Bahraini doctor, right? To be sitting here. Indeed, all of us are. All of us are. Salutes to all those frontline heroes, because all what Dr. Hind said in terms of Bahrain's brilliance, in terms of responding or tackling the spread, is not possible without those frontliners out there. My hats off to all of you who represent that community out there. Dr. George, we heard from Dr. Hind, and we know from January last year, that's even before the case, we had everything stepwise done. The tracing, the testing, the tracking, the vaccine trials, the centers, as she pointed out, the Bahrain International Exhibition Center, It went through all these phases, and until the vaccine rollout, I think Bahrain is the only country in the GCC to have 5 vaccines, and of which 4 are available for public. Despite all which, what has been happening from March down? What is your take on that?
Before I go on to the March takeoff, just to add on to a couple of things that Dr. Hind mentioned, Bahrain had 4 distinct advantages. 1, we are an island country. Number 2, our population is 1.5 million compared to the population in India and Brazil. Number 3, the infrastructure in Bahrain is great. Number 4, the leadership, the task force that set up a command center was very early on. So the whole of the program of the tracking, tracing, testing, and now the vaccination rollout is centrally controlled with an excellent infrastructure around the country to actually reach out and get to all people. I don't think I can look around and say that there would be another country where the vaccine rollout, the tracing and tracking and testing, and the availability, as you said, of 5 different vaccines. All you had to go, and you had the choice of selecting any vaccine and free of cost. And then if you were unwell, you were quarantined and admitted and treated free of cost, Bahraini or expat. Didn't matter. So this was great as far as what Bahrain has actually done. And the question you asked me is, despite all of this, why in March are we seeing the upscale in numbers? 2 reasons. 1, human behavior. Human behavior is, we've been under this, Bahrain is a country that really didn't have a lockdown, and we were very fortunate that we could carry on with our life near normal, even though children were at school and it was virtual learning, and as you said, televideo consultations, we had to adapt very quickly to all of this. However, the human behavior is, after a while, we want to go back to our old habits. All of the messaging and the awareness of physical distancing, hand washing, social, and wearing a mask was slowly beginning to sort of lax at a time when the new variant strains were coming in. So there was a coincidence of new variants, highly infectious strains coming in, with the people now going back to our old behaviors. And that was a bad cocktail. It was like oxygen to a fire. That's exactly what we are seeing now. So unless we separate out the two, and unfortunately we cannot separate out and stop the mutant strains from appearing on our shows, because people are still traveling and they bring the strains in, and they rapidly. But what we can still do is, if you apply the good old public health measures of hand washing, face masks, and social, we can still break this chain. It's not that it's a hopeless condition. And on top of that, we've got access to vaccines. So with this, we can contain this pandemic.
Right. Yes, the habits, you rightly pointed out, we all, I think, tend to take it a little light by last month. Especially when we touched hundreds, it was like very easy. The cases are going down to 100. And that takes me to my next question to Dr. Cherian. Again, highlighting some statistics. The last week's National Task Force press conference highlighted that 70% of the infection is in the local community and 30% is expatriates. Of course, we have had this even before. Many times it has been stated that family gatherings, because the Bahraini culture of wanting to be with your family had led it. But do you think, Doctor, that this has given a feeling among expats, oh, we are safe, it's from the Bahraini community? Especially Bahrain is a country which is home to more than half of the population are expatriates, isn't it? Where do you place them? What is their role in this scenario?
Actually, if you look at the statistics, daily statistics, as you told, majority is from the local population. And the second part is the expatriate community. And the third part, we can say travel related. Some are coming, traveling, and they are coming. These are the 3 groups, actually, we can classify them. And the first group, why the expatriate population, although they are almost equal to the local community, why it is less is that because their social culture is little more different. Most of them are people who are not with the family at Bahrain. They are not that much mingling. They don't have to mingle that much. Secondly, they have a little more restricted type of life here. For a Bahraini community, we know that now also the holy month of Ramadan is coming, and there will be more socializing and more interactions and visits are there. Naturally, there's a more chance of spread is there. And secondly, we read in the newspapers also daily that a 12-year-old girl infected 15 or 20 members of their own family members.
Families,
They
yeah.
go on moving around because they have their own relatives and close families and friends and this one. And now we have come to a stage, it is almost, we have crossed 1 year and 1 month when on February 23rd of last year we had the first case. Now it is almost more than 1 year and people have started living with the COVID. This is not a time that how long we can be away from the COVID, we can follow up all the restrictions, although it is much needed, but still the people take it a little more light way like that, because people adjusted with the COVID now scenario like that. So we hope that by slowly the people taking more seriousness of this COVID situation and with the more legal measures taken by the government, the cases may come down. And let us hope more the vaccination drive also. It is going on in a very fast pace at Bahrain compared to so many other countries where the vaccines are not available. Here most of the 4 vaccines are available at Bahrain. So we are getting the vaccination drive, and nowadays even immediately they register, they get the immediately call for the vaccination.
Yes,
it's not
yes.
a delay also is there. And even those people, even some of the vaccines I noticed that even AstraZeneca from the 28 days they have postponed to 56 days and all. But if somebody is traveling to abroad or outside or India or something, on the 28th day itself they are giving. They go with an air ticket to the Bahrain Exhibition Center and their government is supporting the people to take the vaccination so that they will not miss the second jab. So these are all great things like that, and let us hope by slowly by these measures and other this one it will come down. This is what we hope. Maybe this is the second wave, or they are predicting there is a third wave is on the way or the fourth wave. Whatever is the wave is coming, our only thing what we have to do is more common sense, and we should follow the rules and regulations, because the rules and regulations made by the national task force or the COVID committees and all, it is for the benefit of the people, it is not for them. So it is our duty to follow those rules and follow the rules of the government.
Dr. Dr. George, may I ask you to add to that from the point of expats? Dr. Sherian very neatly explained as to how the responsibility lies with us. But from the expat point of view, do you at some point or the other, did you see that laxity, that feel that, okay, it's not to us, it's among the other community?
No, I don't. I think the laxity is on both sides because, you know, as Dr. Charian said, culturally and socially, you know, the Bahraini community is much more integrated.
Yes.
The expat community, you know, a lot of people, expats are here without their families. So there is no need to go and visit 3 other families. You know, you're living with your friends, and that's the bubble. It's called a natural bubble, social bubble you create. But for Bahrainis, there are extended families. You know, and so naturally, and this virus does not respect culture, anything.
Borders, cultures,
it just goes through. And if it gets a good vector, it will infect that person. So I think the cultural norms of the country, of this part of the world, lends COVID a good chance to actually spread. Whereas, you know, so it's not an apple-to-apple comparison, expats versus Bahrain.
Yeah, correct, yes. Dr. Hind, may I also ask you, the holy month is approaching, and Dr. Sherian rightly touched upon it. It's a time where the families come together, and unfortunately, we may not be able to do it like how it has been. Last year, of course, we had strict regulations saying no to gatherings, but still we had. What will be your advice to your community?
It's the same thing, to be honest. Now that we have the opportunity that mosques are open, we have the coffee shops, restaurants, everything is open. We're not, in comparison to last year, in the same restrictions somehow. Yet there's the social responsibility or the personal responsibility is still the same and even more. So we still need to commit to the same precautions. We still need to commit to the small family gathering. We still need to wear masks, social distancing, make sure to commit to the rules and regulations for each place to make sure that the restaurant, the coffee shops are following the rules and regulation, and if not, to report that. Make sure to sanitize regularly, make sure there is enough social distancing between the tables, if any, and same things in terms of mosques, to have your own personal equipment that also falls in gyms and pools, the same rules and regulations, to make sure that you're aware of it, to make sure that you commit, and the place itself is committed on it. And there's an open access channel to report any violations of rules if any of the places are doing. So the minister is doing a great job following those violations, and it's also a social responsibility from the person himself to commit to protect himself and to protect his surrounding.
Yes. The word is responsibility. You are responsible. Despite all the measures that we heard, the government is doing the best and beyond. Despite, unless we are responsible, it's not going to pass. And on that note, let's take a break.
ലുലു മണി സ്നേഹപൂർവ്വം.
വർണ്ണവസ്ത്രങ്ങളുടെ കമനീയ ശേഖരവുമായി വനിതാ ടെക്സ്റ്റൈൽസ് ബഹ്റിൻ ഇന്ത്യൻ ക്ലബിന് മുൻവശം പ്രവർത്തനം ആരംഭിച്ചിരിക്കുന്നു. വനിതകൾക്ക് മാത്രമല്ല, കുഞ്ഞുങ്ങൾ മുതൽ മുതിർന്നവർ വരെയുള്ള സ്ത്രീ പുരുഷ വസ്ത്രസങ്കല്പങ്ങൾക്ക് അനുയോജ്യമായ വൈവിധ്യ ശേഖരവും വനിതയുടെ പ്രത്യേകതയാണ്. ഇന്ന് തന്നെ സന്ദർശിക്കൂ വനിതാ ടെക്സ്റ്റൈൽസ് ആൻഡ് റെഡിമെയ്ഡ്സ് ബഹ്റിൻ ഇന്ത്യൻ ക്ലബിന് മുൻവശം. വി ഹാവ് ഗോട്ട് ഫാഷൻ ഫോർ എവരിവൺ. വനിതാ ടെക്സ്റ്റൈൽസ് ആൻഡ് റെഡിമെയ്ഡ്സ്.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909-6845, 3909-4806, 3885-2397, or visit www.bahrainmediacity.com. IMAC, Cochin Kala Bhavan.
Welcome back to a panel discussion on COVID-19, the Bahrain scene from BMC Global Life. And joining me this evening is Dr. Hind Al-Sindhi, Dr. George Cherian, and Dr. P.V. Cherian. So we come to the final segment, doctors, and I think perhaps the very important and timely relevance, the vaccines and vaccination. I think every other person, the first thing that you ask another person is, did you get vaccinated or which vaccine? I think that's become the norm, one of the new norms. Vaccine hesitancy versus vaccine positivity. Let's discuss that. Dr. Hind, there are, I think, one of the top 10 threats in the world is misinformation about vaccination. Your comments, please.
Well, no one can really comment on how important vaccination is. If we go into the history of diseases and infectious diseases, we can see the role of vaccine to terminate such diseases. We don't see polio nowadays because of vaccination. Let's say there's no doubt that the vaccine is definitely has some sort of protection. There were a lot of rumors of how the vaccine was quickly announced, launched, and my reply to that would be there's a certain measures or steps internationally known and evidence-based in order to launch any vaccine or to rule it out to the community. And Bahrain have followed all the steps in terms of clinical trials, in terms of having a committee and the NHRA approval, saying how safe and effectivity the vaccine is. There are a couple of vaccines available now, and all have shown high level of safety and high level of effectivity and efficiency. And they are all available for Bahrainis and non-Bahrainis and free of cost. The accessibility of the vaccine itself is a plus or an easy way to get vaccinated. A lot of misbelief saying that if person who had COVID, he had natural immunity, and yet they don't need to get vaccinated. And the rules and regulations here that if he's a frontline worker, then he needs to get vaccinated soon after he recovers. And if he's just a normal person with no high-risk contact, then 90 days post-recovery, which is 3 months post-recovery. Another myth that or we hear often that it might be conspiracies and it's politics and it's economics and it's not related to that. But when we go back and we see the number of cases, we see the deaths all around the world. And if the vaccine is your way out of this pandemic, why not? So any protection is better than no protection at all, regardless of the effectivity or amount of vaccine. Any percentage of that can't protect you or help you to get through this or not get vaccinated, not get infected, or not even getting the complications. So the idea of vaccination here is not to get the disease, but if you encounter the disease, your body will be in response, ready, and it has the antibodies to respond to that infection. And therefore, the complication that you might get with the disease is much less. The duration of illness that you might have or symptoms must be much more less because you're already prepared of what you might get. So my advice is don't listen to rumors, listen to the information from the right sources, from the right people. Go and search, read evidence-based articles, evidence-based literature about it, and see how the impact of vaccination and how it changed the community and how it changed the world just by launching it. And this is our way out of the pandemic by achieving 70%, which is the attained goal of herd immunity or having the community immune. We will be able to overcome this pandemic, hopefully.
Right. And herd immunity is our goal, and all these negativity can really stop the progress towards it, isn't it? Dr. George, as we hear and read, the latest discussion is about the future challenge is vaccine logistics. Logistics of, or the making vaccine available to all countries because of border restrictions, or even we had shortage in between. So then it suddenly slows down the effort towards the herd immunity. What is your take on the vaccine logistics from the Bahrain point of view? Bahrain is a very small country compared to the global challenge that it is.
I think for Bahrain, we've been very lucky that Bahrain was ahead of most of the countries in securing vaccines from different sources.
Yes.
Bahrain just did not rely on a single source to get Pfizer only or Covishield only or Sinopharm only. So we had access to about 4 or 5 different sources of vaccine, and for a population of 1.5 million, that was a brilliant strategy to get adequate number of doses so that all of the population would be vaccinated. Now, Bahrain is not a typical example of what's happening globally. Globally, you've got huge challenges because if you look at it, the most populated countries on planet Earth are India, China, Brazil, Latin American countries. And even though India has got the largest manufacturing plant for vaccine serum in Pune, they cannot produce sufficient vaccines to vaccinate 1.3 billion people there, because most of the AstraZeneca vaccines that is produced there is contracted to supply other countries. And the same happens in Europe. Now there's been a big row between the UK and the EU on how the vaccines were supplied, even between European countries. So that is a real challenge. However, the good news is just look at the United States now. The United States had a very slow, shaky start for various reasons, but now they have absolutely ramped up their vaccines, over 1 million to 1.5 million vaccines a day. The United Kingdom is still doing the same. And so I think unless we address vaccine equity across the globe, we will not defeat COVID. What is happening is, yes, all of us can be immunized and we will feel that we are secure. However, if there are large chunks of the world's population, like in Africa and India and Brazil, who are not vaccinated, the mutant strains will appear there, because the COVID virus has a host that is still able to generate various mutant strains. And one of the unique abilities of this virus is, this is an mRNA virus, which is wholly unstable, so it mutates very frequently. And when it mutates, it could mutate into a less virulent strain or a more virulent strain. We've heard of the Japanese mutant now coming out. So the R numbers can change, the severity of the infections can change. But the good thing also about an mRNA virus is, the vaccine producers can easily tweak the vaccine to actually tackle the mutant strains, which is the brilliance of the mRNA virus. Now, if I look at the different vaccines that are available, Moderna, Pfizer, and one other vaccine, they're all mRNA viruses, mRNA vaccines. Now, AstraZeneca, Johnson & Johnson, Covishield, they're all a virus that is actually encapsulated into an adenovirus. The method of that vaccine production is different to the mRNA viruses. So when people compare, oh, well, I've got a Covishield, I got Pfizer, which is better? No, both are good, because it all depends on the immune response that your body mounts to these viruses. And what is very basic, at a very basic level that people should understand is, when you're exposed to any germ, whether it's a virus or a bacteria, your body mounts a response, an immune response to this infection. And it comes in 2 ways. Initially, what you have is what is called a B cell response that is floating around the body that will isolate and kill the virus even before it infects the host cell. Now, if you have a big viral load, your B cells might not contain it, and then the host gets infected. And if the host gets infected, then the T cells, which is called the killer T cells, are then let out into the system, and it is the killer T cells that produces the antibodies. So when we talk about checking your antibodies, what you're really doing is how much antibodies is produced by the T cells, the killer cells that is circulating in your body, which is the real guys who will actually kill the virus. So different vaccines have different responses in human beings, and even if both of us receive the same vaccine, our bodies might immunologically respond very differently. So it is not comparing numbers and comparing vaccines. But the message I want to give is, regardless of the type of vaccine you have, get yourself vaccinated, because it prevents a death and admission into an intensive care. And as you mentioned, this is the only way we're going to get out of this. Just like how we overcome polio and smallpox in the past. So it's our generation's responsibility to take this, whatever we need to take to actually defeat this virus.
Right. Thank you, Doctor. Dr. Cherian, Dr. George said, literally, go get the jabs, isn't it? Like you said about the headline, go get the jabs. But still, you're a person very close to the community. You interact very close, especially with the expat community. Where do you see the reluctance, or what is the one common reason that people give, or have you come across any such reluctance, and what would be your advice to them?
Actually, first of all, at the outset, I would like to thank the government of the Kingdom of Bahrain, actually for the initiative. They started the vaccination drive. It is actually, as Dr. Hind told, it's an active immunity we are giving to the community. And now we have vaccinated, at least I think we have crossed around 1/3 of the population, almost reaching more than 1/3 of the population. And all vaccines are available, as Dr. George told. Most of the vaccinations are available, even including Sputnik from Russia. So these things are all creating a vision, and most of the vaccines are having good effect. There is nothing. So this is a common question that many people call me daily on a basis. Around 20-30 calls I get which vaccine I should take, which is a better one. So every vaccine has its own advantages, and the main aim is to prevent death and to prevent the complications. This is the only main thing what we have to achieve, and that is the only thing in front of us. There is no other alternative at present to prevent this COVID. There is no other one. Reach a herd immunity, get the number, and then inshallah, let us hope things will be better. So the problem with certain people is the reluctance, or they are watching. They are thinking that, okay, let the others get vaccinated. Let us see what are the side effects or what are the complications they are going to face. And their second part, they are worried about the long-term effects, what will be happening maybe after 5 years or 6 years. But these people have to think it, keep it in their mind. There is nothing there we can say. If you are not taking the vaccine, you get an infection, you go into a ventilator, you go into a complication, because most of the organs can be got infected. It's not only that it is, although it's a respiratory virus, it is not involving the lungs alone. It can go. Recently we had a talk, actually, we had one meeting from New York. I was a participant from Bahrain, and another doctor was participating from India. All other doctors were from New York only, USA, various hospitals in New York. They were talking the same thing. There was a hepatologist who was there about the liver. He was talking about nephrologist who was there. There's a pulmonologist who was there. All were discussing all these things like that. So the main thing what we have to do, we should keep in the mind that this COVID infection will attack any of our vital organs. It can go to the brain, it can go to the vascular system, it can go to disseminated intravascular coagulation, it can go into respiratory failure. So the various complications can set in. So you take the vaccination, you have a confidence, everything is brought out after a clinical trial. It is a 3-phase trial only they have brought it. I took the vaccination in the month of November, when the initial trials were going on at the exhibition center. So I should not have a false sense of 100% of security or something like that, that the vaccination will keep me completely safe. But at least it keeps me a little bit having a feeling, okay, even if I get infected, I will not go into much complication. So the people, what I have to tell and stress to all the community people in Bahrain, to take the vaccination as early as possible, support the government drive. Our country, the Kingdom of Bahrain, the host country, is so kind enough for all treating all expatriates along with the locals. They are all keeping us, and they give. It is free of charge, it is given. We are getting all different types of vaccinations. We don't have a long waiting list. Even if there is any complications, we get a proper treatment. So these things we have to be very thankful for our. We should not call actually a host country. We should call it is a second home actually for us, that we have been taken care. So my request is that vaccination is the only thing, and along with the vaccination, my kind request is, other than the other COVID protocols of masking and social distancing, we should keep our physical and mental health also in the best way possible like that. Physical health is very important for you doing a proper exercise, you are eating a proper healthy food. Then secondly, your mental health also you should keep by interacting with your friends and family friends and all, at least by telephone. You talk to them, you tell your problems, you react. Then even slow breathing, they are telling that if you breathe slowly, it will stimulate your brain to relax like that. So relaxation, meditation, prayer, all these things together, you should work together. That's what I have to request. You vaccinate, you follow all the precautions, keep your physical and mental health very good. So slowly by slowly, let us hope this will go away. And this opportunity, it is actually, we are passing to a stage of fasting and holy month of Ramadan, and so we have to be more cautious during this period. Okay, we know that it is a period of social mingling and social relations and more friendship and all, but still, you take care of the precautions. Your aim is to protect yourself and protect others.
Right, right. Very well said. Let me throw one last question to all three of you in terms of herd immunity. All of you touched upon that, and Dr. Sherin was just talking in terms of numbers. If I remember right, we have completed 500,000 population with the first dose, and almost 18% of the adult population is fully vaccinated with 2 doses. Where do you foresee herd immunity, Bahrain achieving herd immunity? Can we figure out anything from these figures? Because we rolled it out in December, so it's first quarter down, we are 18% of the adult population. Can we have you done any kind of research, any comments?
I think we will see a high rise in number nowadays, especially after the new launching of today's rules of you are only allowed in if you are fully vaccinated,
yes.
The latest, which was only announced today. So I think after that there is a big chance of a lot of people that would be registering for the vaccine. So I really, I am enthusiastic about it, and I really think that within a couple of months we should be reaching the herd immunity, inshallah. Yani I think what I can see from people coming every day, at least where I work in the health center, I can see they are at least around hundreds every day gets vaccinated, either first or second dose. So there is a lot of uptake for the vaccine. And now with those kind of restricted rules or indirect way to direct people toward vaccination, and all the media campaign, and that's one of it, I'm sure, that will help increase awareness of people and educate them, and to get the right information across them, that should take us to where we want to be.
That's promising. Dr. George, what is your take on that?
My take is that most people are looking towards traveling, at least in summer.
Exactly.
And a lot of countries are looking towards a vaccination passport. And if that comes in, and as you said, a lot of people will be lining up to have their vaccines done, because otherwise they might not be able to travel despite a negative PCR. So I think for Bahrain, now that we are well on the way to getting good immunization rates, that certainly by summer I think we will hit that magic number.
Right.
Yeah.
Do you agree to these views, or do you have a different view, Dr. Sherin?
I also think so, because the herd immunity, at least we achieve almost 70 to 80% of the population is completely vaccinated, then we will achieve a herd immunity. The herd immunity is not only helping those, there is a small group of people who cannot take vaccinations. Exactly. So that is very important. For example, now recently, okay, they have done some clinical trials on the pregnant ladies and lactating mothers and all. They have started the vaccination, but still there is a group which is undergoing trial for the young age group till 18 years or 16 years, like that. So that group also is being indirectly protected by the majority of the people taking vaccination. So that's one advantage is there. And the second thing is that whenever we achieve a herd immunity, the people, infectivity is less, the strain on the government services and other health sectors and all are reduced drastically. So these are all the great things like that. So we have to go on taking, and we have to motivate. I am telling it is a duty of the social workers also, the media also, everybody. They should motivate. Even this lecture, what we are giving, this talk is there, very important for the public to reach there. At least some people get motivated to take vaccination who are still away. Because I have got a lot of friends, I advised them to take vaccination. They never took it. And now most of them are infected. So many other people are infected, even those who are working in the health department, health sectors in our department, even the Salmania Accident Emergency Department itself, they did not take and they are infected. So I am telling that this is a motivation actually with these continuous lectures and coming down to the community, and even the news media, even the other media, they are all doing this work. So we should continue this one, and let us hope by the end of this year as Dr. Georgian told, everybody is eagerly waiting. It is more than 1 year, 1 year and 1 month.
Exactly.
I traveled out of Bahrain. I was sitting here only. My children I never met, grandchildren I never met. So these are all, we are actually waiting for those chances are there. So we want to meet actually, and we are a human being, is a social being. So you cannot stay alone for a long time like that. At least we get a chance to mingle with the people, see them and all. It will give psychological relaxation also. So let us hope and pray for the best in the near future.
Right.
Now with the new rules that's happening.
Yes,
only
thank you.
this
Thank you,
evening
Dr. Hind,
that,
for reminding us. Yes,
yeah,
yes.
whoever comes or travels, if he is fully vaccinated, he won't
don't-
have to pay the 36 BD. And
Or poke his nose.
Not even poke his nose 3 times.
3 times, yes. So,
Everything is becoming mandatory. As Dr. Georgian told, even this time Formula 1, which recently happened last 28th, there was it was mandatory. Actually, you should have both vaccination certificate only. You could enter. You couldn't even go there. Even somebody was vaccinated one time and all. They were just kept out. They
Right.
couldn't even enter the part. So it is becoming indirectly. They cannot implement because it is given a special permission or essential utilities, essential use vaccination permission by each country. But one time will come that without vaccination you cannot do so many things like that.
yeah, vaccine passport is something
Yeah,
very,
that's
very
correct, yeah.
possible a future
even,
that we
even
see.
airlines also, Gulf Air and
Yeah.
Qatar Airways and so many
Right.
airlines are also implementing. So let us get vaccinated. It's
Right.
always better, and let us hope things will be improving.
Yes, let's
soon.
really hope that normalcy that we're all longing for is very soon here. And as per the new regulation, it's from the first day of Eid,
Yeah,
I believe.
after
From then,
Ramadan, yes.
you cannot go to restaurants, dine-in, cinemas
Dine-in,
if you're not vaccinated.
Gyms and
So
all.
please go get your jabs. And that's a message out there. And thank you very much for joining me this evening. Can I have your final comments, please?
Thank you for having us. I'm pleased and honored to be here. Thank you for such a great arrangement. It was my honor to be along with my colleagues. And I hope that from this lecture we were able to get some information across to help in raise awareness and answer some correct wrong beliefs and answer some of the inquiries that a lot of people might have. Thank you for a great setup, for an excellent arrangement, and hope people are enjoying this live as much as we do.
Thank you. Dr. George.
My only message is thank you, BMC, for providing us for a platform to reach out to the community. And my last parting words will be, please get your jab. It saves lives, and I think it is our duty to the country, to our fellow citizens, that we are immunized or vaccinated so that we can prevent this malady from infecting other people who are more vulnerable than us. So thank you
Right.
so much. Yeah.
Dr. Cherian.
So I also thank the Bahrain Media Center and Mr. Francis Kaidarat and the team for taking this initiative to conduct this webinar. And let me thank my fellow panelists here, Mr. Dr. George Cherian and Dr. Hind, and also the moderator, Rajiv Unnikrishnan. Always he has been very in the forefront actually to bring out these messages to the common public. As Dr. George Cherian, let me reiterate the same thing what he told. Let us take the vaccination, let us follow the protocols of the COVID prevention, and let us continue for a healthy community. That's what we are looking for. Let us hope there will be normalcy in our near future, and we will have again social gatherings and get-togethers and a happy life. Thank you.
Indeed. We touched upon a number of points here with the holy month approaching. We're all longing for family gatherings out there, and we need to travel. Many things which the panelists said, we all echo together. But at the same time, one important point we need to bear in mind, when all these arrangements are being made by the government, there is a community to whom I referred in the beginning, the frontliners. The burden on them when we slacken the burden on them are doubling. And they too have families. We should not forget that. They are also longing to be back with their families, live a life of normalcy, just like us. When we think of only ourselves, please do think of those heroes out there and the representatives here. Thank you very much. I really enjoyed this evening. Thanks a lot for sharing these wisdom, and I hope people get the right message out there. Yes, my concluding words would be, go get your jabs. And that's me.
Thank you, madam.
Thank you very much. Thank you.
Ramadan Kareem to everybody.
Ramadan Kareem in advance. Thank you, doctors. And that's good night from me, Rajiv Unikrishnan, signing off.